Only the high risk, including people ages 65 and older, will be getting follow-up calls from the county if they test positive for COVID.
The public 2 years in knows what to do. We've been through this.
Seema Shah is San Diego County's medical director for epidemiology and immunization services. She says outbreaks will still be tracked.
SNFs in long-term care facilities. We're still looking at correctional facilities and jails, obviously shelters. Thinking about all the populations that would be at highest risk from morbidity from this disease. Of course, K through 12 is still a significant priority, and we are still seeing outbreaks in those locations.
COVID-19 related hospitalizations have fallen dramatically in San Diego, but case levels aren't exactly where officials want them to be.
We're still looking at anywhere from 300 to 700 cases a day. That is nowhere near where we should be, and that means that Omicron is still here. It's still driving a lot of the disease.
And those cases are from official PCR tests. They don't include any of the increasingly popular at-home test results.
We don't have a good sense of how many more cases are actually out there. And my guess would be it's probably close to double.
We shouldn't try to pretend that COVID is gone. It's absolutely not gone.
Christian Ramers is an infectious disease specialist and chief of population health at Family Health Centers of San Diego. He says they are still treating COVID patients every day, less than during the surge, but he says that the supply chain of treatments has greatly increased.
We really have plenty of medicines to treat people that need it. And we're sort of moving more to a normal phase where this is a disease that has a treatment and you can get diagnosed with it, you can get treatment for it. And we're beyond the time when we had to really triage and use a very limited resource.
Monoclonal antibodies and antivirals are proven to help keep people out of the hospital, but they have to be used within the first few days of symptoms. Supplies of the antibody Shield that offers protection for the immunocompromised are also increasing.
It's really been approved and authorized by the FDA to be used as a preventive, actually, for people that are at high risk or for people that may not have responded to vaccines.
The treatment could help those most at risk ease into the new normal.
Now, these people have been kind of hung out to dry, and they're feeling very anxious and vulnerable as the mask mandates come off.
Raymer says they have given out about 100 doses of Shield, but estimates they have at least 600 other patients who need it. The county says there is plenty of supply. Matt Hoffman, KPBS News.